I'd like to thank the organisers for facilitating this symposium on such an important topic. It's a privilege to be part of it. When it comes to preventing violence against children, we know what works, but how do we get what works out to those who need it, particularly in the context of an emergency? This case study demonstrates how it was possible to widely disseminate parenting support resources during COVID-19 lockdown through faith-based networks and organisations, catalysed by the World Without Orphans network. World Without Orphans is a collaboration of faith-based organisations and faith community networks in 80 countries, working to call and equip national leaders to collaborate in solving their country's orphan and vulnerable children crises. A key component of our work is preventing orphanhood. So preventing violence against children is a priority. With 1.6 billion children out of school at the peak of COVID-19 lockdowns, the risk of violence against children increased significantly. In Sierra Leone, during the 2015 Ebola outbreak, the risk of girls being exploited increased by 30% and teen pregnancies increased by 70%. In May 2020, World Vision estimated that although 30 million children could be infected with COVID-19, 85 million more children worldwide may be exposed to physical, sexual and emotional violence over 3 months as a result of lockdowns. While most children who contract COVID-19 will recover without complications, a large proportion of children who experience violence will experience enduring consequences. In response, Parenting for Lifelong Health, CDC, USAID, UNICEF, World Health Organization and others adapted a proven evidence-based program to produce the COVID-19 parenting tips. Topics included one-on-one time, keeping it positive, structuring up, when children misbehave, managing stress and talking about COVID-19. Further topics have since been added, including keeping children safe online. Although this case study is focusing on the issue of how we get what works to those who need it, I will briefly pause to mention the emerging evidence that demonstrates the importance of positive parenting in the prevention and healing of childhood sexual abuse. There is some evidence that parenting programs can reduce adolescent sexual violence. A review conducted by Together for Girls found that the program Families for Safe Dates reduced high-risk sexual activities and decreased physical violence in dating relationships. The review also found that the Family Matters program, which aimed to improve parent-child communication, which is also a key priority for COVID-19 parenting tips, showed potential in helping prevent child sexual violence. There is also an evidence base that strong family relationships are significant in both the prevention and healing process. Parental relationships can enable children to deal with betrayal, regain self-esteem, and lessen feelings of being responsible for the abuse. Good communication between parents and children can reduce high-risk sexual behaviour, and the simple act of parents knowing the whereabouts of their children can reduce the risk of sexual violence. Now, to return to World Without Orphans' dissemination of the parenting tips. When so much of the world entered lockdown, we looked to identify evidence-based programs that we were already equipping our network to use. Parenting for Lifelong Health was one such program, and the adaptation of this program into tip sheets seemed like it would meet a need that was being identified throughout our network. First, WWO's network was able to rapidly support translation efforts. By the end of March, the tips were available in 31 languages. By 9th of April, 40 languages. By the beginning of May, more than 80 languages. And the tips are now available in more than 100 languages. Within days, we were hearing examples of our partners using the tips in their work with parents and caregivers. In Ukraine, the tips were being distributed along with emergency food parcels. In Romania, the tips were used by Romania Without Orphans as the basis for shareable social media videos. We were encouraged by these examples. However, over the next 2 months, they were dwarfed in the terms of the scale of reach. In Zambia, our partner Forgotten Voices worked with 23 partner churches, reaching 5,750 households with parenting tips, along with disease prevention advice. They were also able to reach, via radio, 3 million listeners. In Malawi, our lead partner is also Forgotten Voices, and within 6 weeks, their partner churches educated more than 2,700 households about positive parenting using the tips. In collaboration with other faith leaders, they've also reached 8 million people via radio, with plans to extend to television. In Sri Lanka, the Alliance Development Trust, through interreligious collaborations, reached 30,000 families alongside COVID-19 mitigation awareness raising. Paraguay Protects Family worked with the Ministry of Health to promote the tips. They were viewed online by 1.1 million people, 15% of the population. In addition, the parenting tips and the impact of COVID-19 lockdown on families has led to the launch of a parenting helpline. As well as demonstrating their ability to rapidly reach large numbers of families, faith-based organisations have demonstrated their creativity. Kyrgyzstan Without Orphans reached over 2 million viewers by turning the parenting tips into animated video clips that were shown on national television. In India, Viva Network used the tips to create phone-based care for vulnerable families. Within the first 3 months, they reached more than 600 families in 6 states. And now Viva networks in 16 other countries are looking to implement the system. It is estimated that in the first 5 months, the total reach of the parenting tips was around 85 million people, with a reach of about 20 million being attributed to World Without Orphans and our partners. Let's now consider what's emerging in terms of impact. This photo is of an 11-year-old girl from Zambia. She explained how her parents have used the parenting tips and now have a deliberate routine to engage their children every day, which she says is helping a lot. Remy, the country director for Forgotten Voices in Zambia, says, "Thanks to parenting tips, family relationships are being enhanced. One parent testified to how it had been difficult for him to relate with his children on seemingly simple life issues. And now he always starts the day with not just a good morning, but instead extends it to questions like, what do you have lined up for the day?" Forgotten Voices, working with Parenting for Lifelong Health team at Oxford University, conducted surveys to understand more about how parents and caregivers perceived the impact of the parenting tip sheets. 83% said they had an increase in confidence in protecting children from sexual abuse. 82% said they had an increase in confidence for positive relationships with children. 66% said there had been a reduction in physical abuse, while 64% said there had been a reduction in emotional abuse. In Malawi, one village head, who is also a parent, said, "We understand that it is very hard for parents to adjust to the new norm, as they will have their children at home due to the schools being closed. The tips not only brings relief as we parent, but also challenges parenting in general. For some of us have failed miserably to parent well. It will leave a lasting impact, and it is amazing we have learnt this through a church in our community." Pastor Holder leads a church in rural Bangladesh. She was very aware that during lockdown children were bored and parents were struggling. As a church, they were trying to keep in regular communication with their Sunday school children. She and her Sunday school teachers were invited to join an online training session organised by Bangladesh Without Orphans. Here they found out about the parenting tips. She said, "In the training, we have trained about how to stay safe during the lockdown and COVID-19 pandemic, and how we can encourage children and their parents about how to spend family time, living as positive, controlling behaviour, keeping calm, and some other topics, which were helpful for the children and for the parents. This illustrates the challenge that so often exists. Multilateral and bilateral experts develop programs that we know work, but are often unable to get it into the hands of those who need it most. Meanwhile, those who need it most are desperately seeking programs to address the needs they see in front of them. This example demonstrates how faith-based organisations and networks can bridge this gap and effectively implement evidence-based action because of their agility, responsiveness and reach. In this case, global reach, right into the heart of local communities. In conclusion, there are 2 additional assets of faith-based organisations that are noteworthy. The first is trust-based relationships. Faith leaders are often among the most trusted people in their communities. So when they recommended the parenting tips, parents and caregivers trusted their content. In addition, it was the trust-based relationship that WWO has with global networks and national organisations that meant that when WWO promoted the tips, these networks and national organisations in turn promoted them to organisations on the ground. The second asset is access. Even in the context of lockdown, faith-based organisations had direct access to families. Finally, World Without Orphans provided a structure that worked effectively. We were able to mobilise global networks and national organisations who were in turn able to mobilise local organisations such as churches and congregations of various faiths, who had direct access to families and communities. And all this was able to happen within days.